Hello, my name is Jennifer Steele. I'm a nurse practitioner student at Maryville University. This is Andy. He'll be my patient for my head-to-toe assessment. Before coming back into the room, Andy emptied his bladder. He had his vital signs checked, along with his height and weight. He also had his vision done by the Snellen and Rosenbaum chart. He came back into our room and got into a gown. I washed my hands, and we will begin our exam. I first start by looking at the head and the face. I'm looking to make sure that the eyes are symmetrical, along with the ears, and they are. I'm looking for any facial deformities or bony structures that are abnormal. After looking for that, I go ahead and I will actually start with testing some of the cranial nerves. So starting with cranial nerve number 7, and I'll have you go ahead and wrinkle your forehead. Good. And close your eyes really tight shut. Puff out your cheeks. And go ahead and give me a smile. Good. Next, I'll check cranial nerve number 12. I'll have you stick out your tongue. Good. And move it from side to side. Good. Cranial nerve number 12 is intact. After that, I'll move to cranial nerve number 5. And Andy, with this, I'm going to go ahead and I'm testing your light sensation. So I'm going to have you close your eyes, and you'll feel either a sharp or a soft side. And you're going to let me know what you feel as I go on your forehead, your cheek, and your chin. So go ahead and close your eyes.
Sharp, soft, sharp, sharp, soft, soft.
Good. And cranial nerve number 5 is intact. Another way to check cranial nerve number 5, I'll actually have you go ahead and clench your jaw shut. And I'll feel for overall tone, and that is normal. And I'll also have you take your tongue and push it into your cheek against my hand. Good. And on the opposite side. Good. And cranial nerve number 5 is intact. After that, I actually will go ahead and palpate the scalp. I will feel for any masses or deformities or any nodules at all. I'm taking note of the hair texture. It is clean, it's a little coarse. I'm also noting if there's that the skin moves freely on the head, which it does. After that, I start going down. I will palpate all the facial bones. Is there any tenderness while I palpate those?
No.
And then I'll also work my way to the sinuses. So I'll do the frontal sinuses. Is there any tenderness or pressure?
No.
And the maxillary sinuses. Any tenderness or pressure?
No.
Good. Next, I'll check the temporal mandibular joint. I'll have you go ahead and open and close your jaw. And close. I'm feeling if there's any grinding or popping sensation, which there is not. Good. And that is normal. Next, I'll go ahead. I'll start with the eyes. I do an overall inspection of the eyes. I'm looking at the sclera is white. That the conjunctiva is pink, and I'll take a look here. Good. Good. I'm noting the eyelashes that they extend outward. I'm noticing the eyelids and they go to the outer campus of the eye, and that's normal. And I'm also noting the eyebrows as well. I'm also going to palpate the lacrimal apparatus. Good. And I'll check pupillary response as well. So go ahead and look straight at me. I'm looking for constriction, and then consensual on the opposite side. Good. Continue to look at me. Good. And then the opposite side for consensual. Good. Next, I'll do the cover and uncover test. I'll have you go ahead and cover one of your eyes. I'm looking for any nystagmus or irregular eye movements, and that is normal. And I'll have you do the opposite eye. Again, look straight at me. I'm looking for any extraocular eye movements or nystagmus, and there is not. That looks good. And then next I'll go through the 6 cardinal fields of gaze. So go ahead and look at my finger, and let me know if you have any blurred vision, double vision, anything like that. And I'm looking for any extraocular eye movements, and follow my finger in. Good. And that's checking cranial nerves 3, 4, and 6, and all of those are intact. So after the eyes, I work my way to the ears. I'm looking that they're symmetrical, which they are. I'm going to go ahead and Let me know if there's tugging on the auricle at all, if that is tender.
No.
What on this side?
No.
Okay, I'm going to go ahead and do a whisper test. So I'll have you put your finger in your left ear, and I'll have you repeat after me what you hear.
Apple.
Good. And then the opposite ear.
Orange.
Good. Next, I'll go to the Weber test, and this is going to check for any unilateral hearing loss. I want you to let me know if you hear it in both ears equally, or if you hear it in one over the other.
Both ears.
Good. And then the Riney test will be the next one. I will do the same thing, strike my tuning fork, and this time I'll actually put on the mastoid bone, and let me know when you stop hearing that.
No.
Okay, and then I'll put it next to the ear, and let me know when you stop hearing that sound.
No.
Good. And air conduction should be twice as long as bone conduction, and that's a normal test for you. I'll go ahead and look in your ears as well. I'm looking at the tympanic membrane, it is clearly gray. There is no serum buildup, and there's no redness that I see. That side looks good. I'll move to the other ear. Doing the same thing. I'm looking at the tympanic membrane. It's nice and clearly gray. It's not bulging. There's no redness, and there's no serum buildup as well. Both look great. After I'm done with the ears, I work my way to the nose. I look to make sure that the nose is midline and the face is not deviated off to one side. If you go ahead and tilt your chin back, I'm going to go ahead and look in both nostrils and nares. I'm looking for any polyps or deformities. I'm looking at hair to see if the hair is more on one side, and that is equal. I'm also looking at the mucosa. That is normal. I'm looking at the turbinates, and those are also normal. There's no lesions or polyps that are noted. I will also have you cover one nostril and go ahead and take a nice deep breath in. That nair is patent, and the opposite side. That nair is patent as well. Good. And I'll test for cranial nerve number 1. Let me know what you smell.
Lavender.
Yes. Good. And that is intact. Then moving down to the mouth, I'm looking at overall character of the mouth, if it's moist, if there is any fissures at all, if it's symmetrical when the patient smiles. And I will have you go ahead and open. I'm looking at the mucosal membrane. I'm looking at the tonsillar pillars, the posterior pharynx. I'm also looking at the tongue. I'm looking for any lesions, so stick your tongue out and then lift it up. There you go. Looking for any lesions that are suspicious of cancer at all. I'm looking at the uvula, that it is midline, and it is. I'm looking at the general overall shape of the teeth, to see if there's any cracks, if there's any dental caries that are obvious, and all that looks really, really good. I'm also taking note of mouth odor or hiatus, which there is none, and there's no abscesses that I see as well. I will go ahead and also have you stick out your tongue, and I'll have you say, ah. Good. The uvula rises, it's midline, and that's testing cranial nerve number 10. And I can also do the gag reflex at that time as well. Next, I'm going to go ahead and work my way down to the neck. I first inspect the trachea is symmetrical. It's not deviated off to one side. The thyroid does not look like it has any masses on it or deformities. I will also go ahead and palpate to see if there's any masses or deformities that I can feel at this time. If there's none, and it does feel midline, I will have you go ahead and take a sip of water. I'm going to check your thyroid while I do this. So hold that sip of water in your mouth, and I'll let you know when to swallow. And go ahead and give me a swallow. Good, and that is normal. I'm also looking to see if there's any jugular venous distension at all. And I'm also going to have you do a couple different tests with some range of motion. So go ahead and push against my hand to the side. Good. Opposite side. Good. Forward. Good. And back. Good. And give me a shoulder shrug as well. Good. That looks good. I'm also going to feel for the carotid pulses at this time. I do that separately. So I would do one side. Feel for that. Good. And then the opposite side. Good. I'm also going to auscultate to hear if there's any bruits at all noted. I'll use the bell of my stethoscope. I'll listen over the carotid. And the thyroid. And that is all normal. And then I will go ahead and feel for the lymph nodes. Let me know if you have any tenderness, okay, while I'm doing this. I would check the pre-auricular, post-auricular, occipital, the tonsillar, the submental, the submandibular, the superficial cervical chain, the posterior cervical chain, and then I'll go a little bit deeper, and I'll check the deep cervical chain. And then I'll move my way into the supraclavicular, and there's no lymphadenopathy that I can feel while performing any of these. So that is all good. After that, I'll go ahead and check your upper extremities. I'll have you put your arms out. I'm looking at overall hair distribution. I'm noting color and also temperature. I'm looking at the hands. Go ahead and turn your hands up as well. Good. And back. And I'm going to check for capillary refill. Good. That's less than 3. I'm noting if there's any, of course, splinter hemorrhages in the fingernails, any clubbing, and overall condition of the nails as well. All of that looks normal. I'll go ahead and check for the brachial pulse. Go and relax your arm. Good. Now go on the opposite side. Good. And your radial. Perfect. Next, I'll have you turn around and I'll inspect your back and your posterior chest area. Bring your gown out. So I'm doing my first general overall inspection. I am noting any skin irregularities or lesions, which there are none. I'm going to look at the general area of the spine, and then I'm going to go ahead and check for some CVA tenderness. So I'm going to percuss over that area. Let me know if there's any tenderness when I percuss over the vertebral area. Any tenderness over that?
No.
And then I'm going to do a little bit deeper percussion over that CVA area. Any tenderness?
No.
Okay. Next, I'm going to go ahead and palpate expansion. I'm going to put my hand right around the 10th rib. I'll have you take a nice deep breath in and out. Good. Again. Good. And there's equal movement on both sides, and that is very reassuring. Next, I'll go ahead and do tactile fremitus. I'm going to put my hands on your back. Go ahead and say 99.
99.
Again.
99.
Good.
99.
Good. After that, I'm going to go ahead and percuss the areas of the chest wall. I'm doing this in a systematic fashion. Good. That sounds good. And then I'll do the lateral chest area as well. Good. Next, I'll do the diaphragmatic excursion. So I'll go ahead and have you take a nice deep breath in and hold it. And I'm going to percuss down the scapula until I go from resonance to dullness, and I will mark that spot. Okay, go and take a nice deep breath out. I'll mark that spot, and then I'll go ahead and take a nice deep breath in and breathe all the way out, and I will percuss up until I meet resonance. Good. And go ahead and breathe regular. And I will note that diameter, which is about 3 to 6 centimeters, and that is normal. I will check the opposite side to compare the two. After doing that, we'll go ahead and auscultate the lung fields. Go ahead and take a nice deep breath in and out. In and out. In. Okay. Now you put your arms above your head, and I will do the lateral aspects. Nice deep breath in and out. Again. Again. Go ahead and turn around, and I will look at the anterior chest wall, and I'll also assess the lungs in the front and heart at this time. And I'll actually go ahead and I'm going to take your gown down. We're just going to put it down to your waist here. And I'll do my general inspection. I'm looking for any deformities at all. I'm looking for any skin irregularities. I'm looking for respiratory effort, respirations. They are unlabored. And looks like overall symmetry is good. And there's even hair distribution too when I notice the chest there. I'm looking to see if there's any pulsations or heaves, and there is not. I'm going to go ahead and palpate now the chest wall, starting with the pericardium. And I'm going to feel for the apical pulse first. I'm feeling for any thrills or heaves or pulsations. I'm going to keep feeling. Good. And there is none. At this time, I'm also going to check the infraclavicular area nodes as well. And those are normal. I'm also going to auscultate the front of the chest at that time, comparing both sides. Take a nice deep breath in and out. Again. 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 Now just put your arms above your head, and I'll do the lateral areas. Nice deep breath in and out. Again. Then relax your arms. Next, I'm going to listen to the heart. We've got aortic, pulmonic, Erb's point, tricuspid, and the mitral. And normal S1 and S2 are heard. There's no murmurs or gallops heard while listening. The lung sounds are clear, and that all looks great. Next, I'll have you go ahead and lay down. We'll inspect the abdomen next. So first I inspect. I'm looking for contour, any pulsations or masses that I can see. I'm also looking at the umbilical area for any hernias. And then I'm going to come to the head here and also do the same. I'm looking for any pulsations or irregularities or masses. And those look good. After I inspect, I'm going to go ahead and auscultate the bell sounds. And I'll check all 4 quadrants. Bell sounds are active in all 4 quadrants. Next, I'm going to go ahead and listen to the aorta, the renal, and the iliac and femoral arteries with the bell of my stethoscope for any bruise at all. So I'm listening to the aorta, the right renal, the left renal, the right iliac, the left iliac, the right femoral, and the left femoral. And there was no bruise heard with that. Next, I'm going to go ahead and percuss the liver border. And I'm going to keep the patient in this position. I'm going to go ahead and percuss down. I'm going to listen for the resonance, and then I'm going to listen for when it turns to dullness, and I'm going to take note of that spot. Okay? And then I'm going to percuss up, also listening for when I hear the dullness, and that will be our liver border. Good. And I'll also do it over the spleen area for any splenic dullness. No, that is normal. I'm going to go ahead and continue with light palpation. I always start with the areas that are non-tender. Do you have any areas that are tender at all that I need to take note of? Okay. So I'll go ahead and start with light palpation of the abdomen. And I'm noticing any facial grimacing, anything like that, guarding while I'm doing this, and any tenderness while I gently palpate. Any tenderness? Next, I'll go to the deep palpation, and I'll do the same format. And I'm feeling if there's any masses, tenderness, or irregularities. Next, I'm going to check the liver border, which is on the right side. I'll go ahead and have you take a nice deep breath in and out. And I'm not able to feel that liver border, which is normal. Next, I'll go ahead and palpate for the kidneys. You'll feel me put my hand underneath your side here. And take a nice deep breath in again and out, and I'll try to capture one of those kidneys. And I'm not able to do that. I'll do the opposite side. So again, nice deep breath in and out. And I was not able to capture a kidney. Next, I will also palpate the aorta to see if there's any aortic pulsation at all. So you'll feel me here. And there's no pulsation at all that I can feel with the aorta. I'm also looking for generalized abdominal muscles and their tone. Go ahead and lift your chin just a little bit and flex those muscles. And good, there's good abdominal tone when I feel for that. Go ahead and sit up, and we'll actually start looking at your legs and your feet. I'll have you put your gown back on here to keep you covered. So looking at the feet and the legs, I'm actually first going to look for hair distribution, and that is equal bilaterally. I'm also looking at overall muscle mass. I'm taking note if there's any edema, and also if there's any skin irregularities or lesions. I'm going to note the temperature of both legs, and those are the same. And then I'm going to work my way down to the pulses. So I'm going to do the dorsalis pedis pulse. So the pedal pulse on top of the foot here. And then I'll do the opposite foot, the left, for the pedal pulse. And those are both +2 equal bilaterally. And then I'll go to the posterior tibial. And the opposite. And those are both +2 equal bilaterally. Then I go to the popliteal, and that's behind the knee here. And the opposite. Good. And those are both +2 and equal bilaterally. Now I'm going to check some reflexes. Let me hand me your arm and relax. I'm going to do the brachial. Okay. Okay. And then the opposite arm here. Okay. These are +1. And I'll go to the patellar or the knee. And relax your leg. Okay. And the opposite. Okay. And those are also +1. Then I'll go down to the Achilles tendon. I'll have you relax your ankle and your leg. Good. +1. And also +1. Next, I'm going to head and do some muscle strength for the cervical spine. We kind of already did this earlier, but I'll have you just kind of do some passive range of motion first. Go ahead and put your head side to side. And the opposite side. Good. And then back and forward. Any tenderness or pain with that?
Yeah.
And I'll have you do it against some resistance. Same thing. Side to side. Good. Other side. Good. Front. Good. Back. Good. And go ahead and shrug your shoulders for me. Good. Overall muscle strength is good in that area for the cervical spine. I'll have you go ahead and put your arms up, and I'm going to test your resistance against me. So go ahead and pull. Good. And there's good muscle tone there. So next I'll have you go ahead and stand up, and we'll do the lumbar spine. I'll have you lean forward. I'm going to take note, lean forward, of any irregular curvature or scoliosis. That is all normal. Okay, go ahead and stand back up. I'll have you twist from side to side. Good. Any pain or tenderness with that?
No.
Good. And then also side to side this way. Good. And the other way. Good. Thank you, Andy. That concludes our head to toe assessment.